As the temperature drops and we enter the autumnal season, there are a number of illnesses that reach their height. Our bodies may be greatly impacted by unexpected changes in temperature, strong winds, fluctuating degrees of humidity, and an increase in rainfall. Being prepared with methods to prevent infections and strengthen your immune system is the best strategy to avoid sickness that peaks in the autumn. This video discusses 8 illnesses whose incidence is known to peak in the fall, along with some advice on how to avoid them. Common cold. The common cold seems to be most prevalent as the autumn season begins, although it may strike at any time of year. The common cold is marked by symptoms including a low-grade fever, runny nose, body pains, headache, cough, sneezing, congestion, or sore throat that may linger for a few days to a few weeks. Most colds happen in the fall or winter, so it's important to take precautions like washing your hands often, eating well, dealing with stress, and spending as little time as possible in busy places. Seasonal allergies. Seasonal allergies patients sufferers often have their worst symptoms in the autumn. The main autumn allergy triggers are dust mites, ragweed, and mold. Coughing, sneezing, stuffy or runny nose, headache, sore throat, exhaustion, watery and itchy eyes, snoring, itchy sinuses or throat, and congestion are common seasonal allergy symptoms. Some preventative advice would be to shut the windows of your house and vehicle to reduce unneeded exposure. Also, you should take a shower right away after being outdoors to reduce the symptoms. Flu. Another viral illness that often peaks in the autumn and winter is the flu virus, which affects your nose, throat, and lungs. The common symptoms of this sickness are fever, diarrhea, exhaustion, chills, nausea, body pains, headaches, coughs, chest tightness, or sore throat. A few efficient flu prevention strategies include avoiding crowded places and constantly washing your hands. And it could be beneficial to boost your immunity by continuing to exercise regularly and eating a healthy diet. And you could also think about being vaccinated every year. Arthritis. The illness known as arthritis causes the joints to enlarge and become painful. Although arthritic symptoms may occur at any time of the year, people who have them often report that the chilly, moist weather can make them worse. The signs of arthritis include fatigue, stiffness, joint pain, swelling, and sensitivity in the joints. If you want to avoid an arthritic flare-up when the weather changes, there is prophylactic measures should be taken, such as making sure to get a balanced diet that includes fruits, vegetables, seafood, and nuts. Also, it's important to exercise often to keep your joints flexible and to maintain a healthy weight to avoid putting pressure on your joints. Asthma. Asthma is a sickness that frequently rises in the autumn. Cold and wet weather is considered to raise the likelihood of asthma crises by desiccating the airways. Asthma flare-ups could also be triggered throughout the autumn by other frequent diseases like the flu and the common cold. The symptoms of asthma brought on by a cold are chest tightness, coughing, wheezing, shortness of breath, difficulty speaking or sleeping. By taking precautions, such as avoiding asthma triggers, stopping smoking, and living in smoke-free areas, you may reduce your chance of experiencing an asthma attack when the weather changes. Monitoring your respiration and using your inhaler if you start to have breathing problems may also be useful. Chronic ear infections. Autumn is the season when ear infections are most likely to happen. A virus or inflammation in the ear is the main cause of the infections. Children are frequently more susceptible to having ear infections, which may also be caused by other diseases, including the flu, allergies, and the common cold. Acute ear infections often cause earaches, hearing loss, nausea, dizziness, diarrhea, and a sense of fullness or sensitivity within the ear. If you want to prevent ear infections, you should avoid inserting cotton buds or other things into your ears and wash your hands properly. Teaching your kids good hygiene habits is essential if you want to prevent them from getting an ear infection. Sinusitis. Sinusitis is a swelling or inflammation of the tissue lining the sinuses. This sickness tends to be more prevalent in the autumn and winter because the most frequent causes of sinusitis, such as allergies, colds, and the flu, are already prevalent at this time of year. Postnasal drip, sensitivity around the eyes and nose bridge, tooth pain, headache, discolored nasal discharge, fever, and nasal congestion are all signs of sinusitis. There are some measures preventive to avoid sinusitis, including keeping your nose wet with saline spray, drinking enough liquids to maintain your nasal excretion thin, controlling your allergies, and avoiding air travel. Sore throat. The closer we get to autumn, the more probable it is that you'll have a sore throat. Your symptoms might start with an itchy or dry throat before developing into a full-blown sore throat. You can also have symptoms including chills, a hoarse voice, difficulty swallowing, enlarged neck glands, lack of appetite, itchy eyes, and body pains. Seasonal allergies. The influenza and the common cold are often accompanied by sore throats as symptoms. If you want to avoid getting a sore throat as we enter the winter months, you should avoid sharing utensils, food, or drink with anyone else, and be sure to often wash your hands. In order to keep your throat moist, it could also be good to make sure you're drinking enough water.